WMAL presents Distinguished Doctors, featuring Dr. Alan Blosser of Gastrointestinal Medicine Associates.
Welcome to the Gastroenterology Center of Virginia. We are going to be walking you through a typical screening colonoscopy procedure, which is done several thousand times here at the Gastroenterology Center of Virginia. We're one of the largest privately owned endoscopy centers in the state of Virginia, with an excellent safety record and great success rate. After you are registered, you go to the pre-op area where you have an IV placed. Then the anesthesiologist, or in this case a certified registered nurse anesthetist, will bring you back to the room, place you on a stretcher, and sedate you with a drug called propofol. As you're sedated, I will then take the colonoscope, which is a long flexible tube with a video camera, a video chip, and actually functioning channel, working channel in it. While sedated, I actually introduce the endoscope into the rectum and advance it all the way around to the cecum, where the appendix and the appendiceal orifice and the ileocecal valve are subsequently identified. During the process, if we identify an abnormality, can you hand me a biopsy forceps, please? We have the ability to not only locate it within the colon, but we can as well remove it with a simple biopsy forceps, as you can see here. Open, close, open, close. We are able to introduce it through the scope into the colon and remove any material or specimens that we need to. Once the specimen has been retrieved, Heather then will place it in a container whereby it will then be sent off to a pathologist for review, to make sure there's no evidence of cancer and to establish a diagnosis of whatever we identify. The colonoscope is subsequently withdrawn. The colon is decompressed. The patient, while sedated, will subsequently go to the recovery room where you wake up about a half hour later. I will then speak with you and your family members, because there is somebody that has to drive you to and from the procedure. Because of sedation, we can't medically legally allow you to drive home, but I'll review the findings and make recommendations as to when the next colonoscopy would be. It can be as soon as 1 year or as long as 10 years. In the example today, African Americans should have start screening colonoscopies at age 45. The rest of the general population begins at age 50. It is the single most important test you can have after the age of 50. And by all accounts is a life-saving procedure, given the fact that colon cancer is the second leading cause of cancer death in the United States. Please get your screening colonoscopy at the nearest opportunity. Thank you.